In this video, we are going to cover depression for AQA A Level Psychology. The aim is to make sure you know exactly what the specification requires, so that you can produce clear, accurate exam answers and pick up strong marks. We are going to look at 4 main areas: the characteristics of depression, Beck's negative triad, Ellis's ABC model, and cognitive behaviour therapy, or CBT. A very common exam question is to ask about the characteristics of depression. For top marks, you need to organise them into 3 categories: behavioural, emotional, and cognitive. Behavioural characteristics are changes in what a person does. Emotional characteristics are changes in what a person feels. Cognitive characteristics are changes in how a person thinks. That 3-part structure is very important because it helps you give a clear, well-organised description in the exam. Let's start with the behavioural characteristics of depression. These are changes in outward behaviour. One common behavioural characteristic is lower activity levels. A person may lose motivation, withdraw from normal life, and stop doing activities they used to enjoy. Another behavioural characteristic is disrupted sleep. Some people with depression sleep too little, while others sleep too much. Both can happen. A third behavioural characteristic is disrupted eating. A person may lose their appetite, or they may overeat. Again, the important point is that their normal pattern of behaviour changes significantly. Now, let's look at the emotional characteristics of depression. The most obvious one is low mood. This means persistent sadness or a heavy emotional feeling that does not just pass quickly. Another emotional characteristic is anger and irritability. Depression doesn't always appear as quiet sadness. Sometimes a person becomes more easily frustrated, more short-tempered, or more emotionally sensitive. A third emotional characteristic is lower self-esteem. This means the person feels less confident, less valuable, and more critical of themselves. So emotionally, depression often involves sadness, irritability, and a damaged sense of self-worth. Beck's cognitive theory argues that depressed people do not just feel bad. They also think in a deeply negative way. His main idea is that these negative thought patterns help to produce and maintain depression. So according to Beck, the problem is not only the emotional state, it is also the person's pattern of thinking. The key concept you must know is the negative triad. This is directly named on the AQA specification, so it needs to be learned very securely. The triad consists of 3 linked negative views, and each one reinforces the others. Beck's negative triad has 3 parts. First, a negative view of the self. The person thinks things like, "I am useless," or "I am worthless." Second, a negative view of the world. The person sees life as unfair, difficult, or full of obstacles. Third, a negative view of the future. The person believes that nothing will improve and that things will stay bad. These 3 views work together. If someone sees themselves negatively, they are more likely to see the world negatively. If they see the world negatively, they are more likely to expect a hopeless future. That creates a cycle of negative thinking which helps maintain depression. Beck also talked about schemas. A schema is a mental framework or template that helps us interpret the world. Negative schemas are distorted mental frameworks that lead a person to interpret experiences in a pessimistic, self-critical way. So if something goes wrong, the person does not see it as one isolated setback. Instead, they may see it as proof that they are a failure. You can think of it as a negative filter. First, an event happens. Second, the negative schema is activated. Third, the person interprets the event negatively. That negative interpretation then confirms the person's existing beliefs. So schemas help explain why depressed thinking can become automatic. Now, let's turn to Ellis. Ellis also gave a cognitive explanation of depression, but it is different from Beck's. Ellis argued that depression is not caused directly by events themselves. It is caused by the beliefs people hold about those events. This is the central insight of the ABC model. Two people can experience exactly the same event, but react very differently. That difference happens because they interpret the event differently. So for Ellis, what matters most is not simply what happened, but what the person believes about what happened. At this point, it is very important not to mix Beck and Ellis up. Beck focuses on the negative triad and negative schemas. His theory is about patterns of negative thinking, especially negative views of the self, world, and future. Ellis focuses on the ABC model. His theory is about the way irrational beliefs turn an activating event into an emotional consequence. So both are cognitive explanations, but they are not the same. In the exam, always use the correct language for each theory. Now let's move on to treatment. Cognitive behaviour therapy, or CBT, is based on the idea that if faulty thinking contributes to depression, then changing that thinking should reduce depression. CBT aims to identify unhelpful thoughts, challenge those thoughts, and replace them with more realistic and balanced alternatives. This is important. CBT is not just talking about feelings, it is an active process. The therapist works with the client to examine thoughts carefully and question whether those thoughts are accurate, rational, or helpful. Here is a simple example of how CBT works in practice. The irrational thought might be, I failed once, so I'm a total failure. That is an example of absolutist thinking. There is no middle ground, and it reinforces depression. In CBT, that thought is challenged. The therapist might ask, is one failure really proof that you are a complete failure? What does the evidence actually show? The aim is to replace the irrational thought with a more balanced one, such as, I did badly this time, but I can improve. That new thought is more realistic and more proportionate. So this slide shows that CBT is not just a label. It is a process of identifying, testing, and changing irrational beliefs. Now let's evaluate the cognitive approach. One strength is practical application. The cognitive approach led to CBT, which is a widely used and effective treatment for depression. That gives the theory real-world value because it has produced something useful. However, there is also a cause and effect problem. We cannot be completely sure whether negative thinking causes depression or whether being depressed causes negative thinking. So the theory may describe what depressed thinking looks like without fully proving that it is the original cause. Another limitation is that the approach may be too narrow. It focuses mainly on thoughts, but depression may also involve biological factors, such as genetics or brain chemistry, and social factors, such as stress or difficult life events. So the cognitive explanation is useful, but it may not be complete on its own. That leads to a final evaluative judgment. A purely cognitive explanation is probably too simple. An interactionist explanation is more convincing. This means depression is better understood as the result of several factors working together. A person may have a cognitive vulnerability, such as a tendency towards negative thinking, but depression may only develop when that combines with stress, loss, or difficult life circumstances. So rather than seeing cognition as the whole explanation, it is often stronger to see it as one part of a more complete picture. Let's finish by linking this topic to the 16-mark essay. For A01 description, you need accurate knowledge of Beck's negative triad, Ellis's ABC model with irrational beliefs, and CBT, including the process of challenging irrational thoughts. For A03 evaluation, you need around 3 to 4 clear evaluative points. Good points include practical application through CBT, the cause and effect problem, the idea that the approach is too narrow or incomplete, and the final interactionist judgment. You do not need a long introduction. You also do not need a separate conclusion unless it helps you make a brief final judgment. What really matters is that the essay is clear, accurate, balanced, and focused on the question. So, to summarise the core rules for this topic, first, you must know the 3 categories of characteristics: behavioural, emotional, and cognitive, with examples of each. Second, you must know Beck's negative triad, negative views of the self, the world, and the future. Third, you must know Ellis's ABC model, especially the point that the belief comes between the event and the consequence. Fourth, you must know CBT, including how irrational thoughts are challenged, and you must be ready to evaluate the cognitive approach using a few strong AO3 points.